Hello, everyone. This is Dr. Larson here at 6:30. We're going to go ahead and get started, and people I think will kind of trickle in as we're talking as well. So let me just take a look at that quick here. Okay. So today we're doing a called a Q&A session. This is something I thought about doing this for a while. To give a little bit of background, I've been doing functional medicine, lab testing, clinical nutrition of all different areas of health for almost 30 years. And so about 10 years ago, I did quite a few of like community education kinds of seminars. One of my most popular ones was called Mastering Hormone Balance for Women. And I actually did record that as a webinar and have it on our website. So if you go to healingchoices.com, you'll see a tab for education. In that, you'll see a recording of that if that topic interests you. We can talk about all hormone stuff today if you want to as well. But one of the things I enjoyed the most about doing the those kinds of presentations was really the questions that people ask. So I thought, well, it's what I really enjoy doing is just answering questions, educating people, sharing information. So why not just do strictly an open forum Q&A kind of webinar format? You can ask any kind of question that you want to related to health or functional medicine or again, lab testing, nutrition, looking at the more common kinds of things that we see people in the clinical environment. It's a lot of things related to hormones, so both female and male hormone balance and function, a lot of testing of thyroid and improving thyroid function. Fatigue is one of the more common things that people will come and talk with us about. A lot of digestive issues, autoimmune. So it's really just totally open format. Whatever kind of questions that you have, I have kind of this database of almost 30 years of experience helping people with these different scenarios. And so I just want to let the questions of people that attend. I did get a few questions by email. I think we can look at that as well. But I really want the questions of you attending to kind of guide the conversation in terms of what we talk about. I'm also recording this, so if in watching this recording in the future, if there's a question you have of something, then send us an email. My thought right now is I'll do this on maybe once a month basis, create this opportunity for people. So if you are watching this as a recording and you have a question on something you'd like me to cover on a future Q&A session, then send your email to the clinic, and that email address is service@healingchoices.com. Okay, so let's get into it. I think for those that are attending, it should be towards the bottom of your screen. You should see a button to do what's called raise hand. So if you do that, I will kind of select you, and then you can just go ahead and talk. Don't have to share your video if you don't want to, that's fine. Or I think with this system over, if you go to the bottom, there's the chat button. You can open up a chat and you can type in a question. It can come in that way as well. So who's going to be our brave first person to throw a question out there? So great. Yep, I have a question from Jody. Hi, Jody. The question is, have you heard recently that postmenopausal women should not take calcium supplements and get it from food instead? It sounded like supplements could affect heart health. So I haven't heard that specifically, but that does make me think of a couple things. So one of the concerns, it kind of gets back into vitamin D, and we should talk a little bit more about vitamin D as well. So one of the things to think about as calcium goes into the blood, whether it's calcium that we're consuming or when we're taking vitamin D, that's one of the actions of vitamin D is it brings more calcium in the blood. We want to make sure that calcium goes to the proper tissue, such as bone, get a little bit in muscle, a little bit in the nervous system. We don't want the calcium going to the wrong tissue. So we don't want it going to certain organ systems. We certainly don't want it going into the cardiovascular system and the blood vessels, contributing to hardening of arteries as well. So that is why vitamin D, the most current research, it's best to take vitamin D with vitamin K or K2. The reason is that vitamin K acts as a director, telling the calcium to go to the proper tissue and not to the wrong tissue that we don't want it to go to as well. So to expand a little bit more on vitamin D, since I talked about that a little bit, it's a good thing to talk about. Vitamin D is easily one of the more heavily researched of all the vitamins and minerals for quite a few years now. Vitamin D, we look at the benefits of vitamin D. It has involvement in blood sugar control. Your pancreas needs enough vitamin D in order to produce insulin. Vitamin D is involved in hormone balance of both male and female hormones. Vitamin D is sometimes thought of as a hormone itself. It has a chemical structure that makes us think of hormone, and it has an action on your cells and tissues that um, almost gives direction like a hormone might do to certain cells and tissues as well. Vitamin D is involved in the balance of brain chemistry. We think of vitamin D being strongly important towards the immune system. It seems to have more of an antiviral benefit. And so, for example, as we do lab testing, we see people are low, sometimes quite low in vitamin D. When we work to get their vitamin D levels up to healthier level, they will comment that they can be around people that have a cold or a flu or a virus, and they just don't get sick as easily like they used to in the past. I would argue that the most important benefit of vitamin D are the cancer protective effects. In that, vitamin D is quite powerful to prevent or suppress abnormal cell growth or cancer cell growth as well. Even to the degree, I'm gonna share my screen. I'm gonna pull up a little chart here. So let me first share my screen, and let me go to the proper place here that I want to go to as I'm sharing my screen. So hopefully you can see on my screen right now, it's kind of a chart. At the top it says disease incidence prevention by serum vitamin D level. So this was a research done by a group of people. The research was done quite a few years ago, but what they looked at was the incidence of different kinds of cancers or health conditions like lymphoma, diabetes, fractures, autoimmune conditions. They looked at this in relation to a person's vitamin D level. This is a very large study that was done. And so I'm gonna pick on the results as it relates to breast cancer here. So it's the kind of the second one down on the listing of conditions. When you follow that over to the side, and maybe you can see my cursor, what it is saying is that at a vitamin D level in blood testing, testing at a level of 34, there was a 30% decrease in the incidence of breast cancer. So 30% of people that would have gotten breast cancer actually did not get breast cancer. If we extrapolate out, if we go further down that line where it shows the pink line and the X's, it is saying here when vitamin D level tested at a level of at least 50, there was a 80%, 83% decrease in the incidence of breast cancer. And this is like super, super dramatic. It's, really this is saying that if all women consistently were to get their vitamin D levels tested, if they were to make sure that their vitamin D levels were at least at 50 based on this research, there is a large percentage of women that it's likely that they would not get breast cancer, or the ones that would have gotten diagnosed, maybe they wouldn't have had that diagnosis. It's because vitamin D has such a strong ability to prevent or suppress abnormal cell growth, which is just a fancy way of saying cancer cell growth as well. Okay, so when we look at lab testing for vitamin D, I'm going to shrink this back down. When we look at lab testing for vitamin D, in functional medicine, the reference range we look at is different than what you see in typical lab testing. This gets to the difference of functional medicine versus going to kind of your typical medical provider. Most medical providers will rely on a reference range that's provided by the lab, which can be quite a wide range of what they're saying is normal. So typically what is thought of lab testing wise for a normal range of vitamin D typically goes from like 30 up to maybe 80, maybe 90, depends on the lab. We'll say 30 to 80. Um, However, that's a very wide range of what the lab is saying is normal. And so in functional medicine, what makes functional medicine different is we look at um, lab results in a more critical way, in a more narrow range of what we know to be optimal or best for function. So the point is, with vitamin D, we're looking for the majority of people to ideally be testing in a range of like 60 to 80 is what we think of as ideal in functional medicine. There are a couple exceptions. If a person has had a personal history of cancer at some point in time in their life, if they have a very strong family history of cancer, or if there's any kind of known autoimmune condition going on within that person, we actually will say that that person's normal. If they have cancer or autoimmune, that person's normal is in the next higher range of 80 to 100. Again, because vitamin D is very powerful to prevent or suppress abnormal cell growth, but also vitamin D, among the different vitamins and minerals and nutrients, has quite a powerful effect to take an immune system that's kind of gotten out of control and help better regulate it under a better level of control within that too. So, any other questions on vitamin D or what I just talked about? Otherwise, any questions of anything, go into your chat or the Q&A and go ahead and type it in. I'll be happy to address that question. So who's next? Who would like to ask the next question? As we're waiting for that, let's go in the vitamin D. The reason why I went in detail, that was one of the questions I received by email, was to talk more about vitamin D. So again, to clarify, vitamin D3 in supplement form with vitamin K, the current research shows that's the optimal way of doing that, to make sure that calcium is going to the proper tissue, not to the wrong tissue. Okay. Then as we're waiting, okay, so another question is osteoporosis health, how to prevent. That's a great thing to talk about. So I think to understand how to affect whether it's osteopenia, which is kind of like an earlier stage of bone loss, and osteoporosis is kind of a later stage of kind of a greater degree of bone loss. It helps to understand how do we get the bone density to change, right? How does calcium get into the bone tissue? So you look at the process from beginning to end, from consuming calcium like minerals, other minerals go in the bone tissue. Let's talk through that process of how then all the steps that has to go through to actually become part of bone tissue. So the first step, as you might imagine, is you just have to consume enough of not just calcium, but it's other minerals too that go into the bone. You have to consume enough through your diet. So you have to get foods that are more kind of calcium rich. So we're thinking about like nuts and seeds, dark green leafy vegetables. If you're open to eating meat, red meats are going to be more calcium based as well. If a person is already been diagnosed with osteopenia or osteoporosis, then they're likely going to benefit from supplementing calcium. It's going to be hard to get enough through food to be at a therapeutic level to get the therapeutic effect of strengthening that bone tissue. So first part is just consuming enough calcium, whether it's through food or through supplement. Then that calcium has to go into, or that food or supplement has to go into the stomach. So that's the next important step, because there needs to be enough stomach acid to properly digest, break down those minerals so you can easily absorb that. So imagine these minerals, calcium, magnesium, all these different minerals out in nature are kind of this hard, rocky, salt, whatever, hard substance. So imagine how strong that stomach acid has to be to effectively break those minerals down to their smallest component so you can easily digest and absorb it and get it into your body, get into your bloodstream so it can go to your cells and tissues. And so the problem or the difficulty with that, it's very common for all of us as we get older that our stomach acid production starts to slow down. So it's maybe then not coincidence that as we get older, there's an increased chance of starting to get bone loss because people start not digesting well, they're not getting enough calcium to then get into the blood, to then get into the bone. So from the stomach and digestion, there needs to be enough vitamin D, that calcium into the blood. And then from the blood, there needs to be enough healthy fats, omega-3s, to help push that calcium in the bone tissue. So those are the basic steps. There's more to it than that. The basic steps: consuming enough calcium, enough stomach acid to digest and absorb that calcium, you need vitamin D to bring that calcium into the blood, enough of the healthy fats that help push that calcium in the bone tissue. So that's the basics. Beyond that, there are other elements that are involved. And so we think about, especially for women, but also to men, we think about what's going on with hormones and the balance of female hormones. And this is part of the reason why women are more likely to get diagnosed with osteopenia or osteoporosis is because of the hormone difference between men and women. And goes back to why there was this larger study done a long time ago for hormone replacement was partly in relation to helping to prevent osteopenia, osteoporosis, and the incidence of bone fracture in the elderly as well. So when we look at what these different hormones do between progesterone, estrogen, testosterone, the reason why estrogen was emphasized many years ago in hormone replacement, estrogen helps to slow the breakdown or the loss of bone tissue. In addition to that, the other hormones are involved. And so the idea was if, typically women, they go into menopause, estrogen levels drop down, let's make sure they have more estrogen so they're not losing bone tissue as rapidly, right? They're not losing bone density as rapidly. But that's not the only hormone that we worry about. While estrogen helps slow the loss of bone, the other hormones such as progesterone, testosterone, DHEA, they actually help you to build new bone tissue. So on the hormone side of osteoporosis, it's not just a game of estrogen. We care about estrogen, but we care just as much about progesterone, DHEA, testosterone, in the helping in the building of new bone tissue as well. In addition to the consumption digestive process, in addition to the hormone variables, we get into the next piece, which is just putting enough impact or strain, if you want to call that, into the muscle, into the bone tissue to get the bone to respond to build itself up and to build bone density. So there's actually a process they call it Wolff's Law, just the name of it, the name doesn't matter. But basically, you need to be doing enough activity or exercise or typically something that's going to get impact. So whether it's walking or rebounding or something to get a little bit of impact into your feet, which will transmit up to into your bone tissue, or you need to be doing enough of exercise, for example, with weight or resistance training, where you're contracting more muscles, which will get more pressure into bone tissue as well. Between the two, I would strongly recommend, they're both good, but I strongly recommend, especially as we get older, that everyone is doing things to encourage muscle contraction, to maintain, if not build muscle tissue, simply because you look at one of the more important variables that determines both how long we live, but more importantly, how healthy we will be as we get older. It's the amount and the quality of muscle in our body. And the unfortunate thing is that it's not uncommon for all of us as we get older, activity starts to go down and we start to lose a percentage of muscle tissue as we get older. And so just if you can instill into your mind just how important it is to preserve, maintain that muscle tissue, if not actually increase muscle tissue, it can be a dramatic difference in not just the length of your life, but more importantly, the quality of your health by having that extra muscle tissue. And so the reason why that matters is because in our muscle tissue, we store away reserves of nutrients and resources. So under a time of greater injury, under a time of greater illness, we have this with better muscle tissue, we have this greater reserve of resource that our body can draw from that muscle tissue to help us recover from that injury more easily or to recover from that illness more easily too. Okay. Next question is, do we do blood work to check testosterone levels for men? And if so, what kind of treatment or supplements are available? So we do. So when we're looking at in our clinic, when we do a larger blood panel of testing, the name we give this, we call it a super panel. And so we call it that because it's a much more thorough testing on the hormone side. In fact, let me show you a little diagram here. So I'm going to go back to my screen and let me open up one thing. So here I'm going to show you the kind of the female process, and then I'll describe the male process. This will be kind of leading into what this larger blood panel of testing looks like. So one of the interesting things is we'll have women that'll come in and they might already be on some kind of hormone replacement. Maybe they're on an estrogen patch or some kind of progesterone pill or testosterone or whatever it is. And it surprises me how often women are prescribed this medically, but they never did any testing in the first place, right? They're just going based off symptom, and medically they're saying, well, it sounds like this is probably what's going on. Let's go ahead and put you on an estrogen patch, just see how you feel. And certainly it can help a person, help a woman feel better. But my concern is, you're kind of guessing at that point. It might be a good educated guess. It might be a guess that's right on, but it's still a guess. And how do you know where the starting point is? And you're doing some kind of hormone replacement. And how do you check later on to make sure that it's actually things are getting better that you can compare to the original testing, right? So in a functional medicine process, we're always going to test or measure initially to get a baseline so we know what direction we need to go with hormones or really anything, and then do a follow-up testing to make sure that what we're recommending is getting the job done. So back to hormones. So not a lot of people know when it comes to hormone testing, everything starts with cholesterol. So cholesterol is what we call the precursor. It's the base ingredient. So we need to make sure there's enough cholesterol there in the first place, which for most people is not the problem. Most people have enough, if not more than enough. Before cholesterol, in terms of female hormone testing, before cholesterol can convert down to the hormones that we think of, like progesterone, estrogen, testosterone, cholesterol first has to become this hormone called pregnenolone. So not a lot of people have heard of pregnenolone, even fewer get it tested, which is really unfortunate because pregnenolone is the precursor to all these other hormones that get produced, after cholesterol goes to pregnenolone. Pregnenolone, easily, as we do a lot of testing of pregnenolone, and it's more women that we see, easily more than half of women tend to be low on pregnenolone. And when it is low, we can supplement or provide this just like we can a lot of other things. And people often comment that they're sleeping better, better mood, better energy. But technically, if you're sleeping better, you're probably just going to feel better overall, anyways. Pregnenolone has a little bit of anti-inflammatory benefit. Um, Pregnenolone, there's really good research on pregnenolone and how it's protective towards the memory areas of the brain. So having healthy pregnenolone can be preventive against things like dementia and Alzheimer's. For some people, also, pregnenolone, when it's low, and when we provide that, it can kind of fix a really important kind of piece in their overall metabolism. And I'm one of those people, or when I finally got around to pregnenolone, my pregnenolone tested quite low, actually. And when I started supplementing that, within that first week, I lost 8 or 9 pounds, and I didn't do anything different, diet or exercise. It was just that was the only thing different that I did. I'm always hesitant to share that story because that won't be the case for everybody. For me personally, it fixed a pretty important kind of weak link in my hormone creation, and I do see other people that we work with where that's an element of that too. Then from pregnenolone, we branch off different directions. You can see, hopefully, you can see the diagram. It branches off one way towards progesterone, and then straight down towards cortisol, and the other direction towards DHEA. So if we follow the pathway from cholesterol to pregnenolone towards the DHEA, then from there, that's where we get our production of estrogen and testosterone. So estrogen, there are three main kinds of estrogen. There's actually more estrogen than those three, but there's the three main, like most abundant versions of estrogen. And they're labeled E1, E2, E3. The E3, the estriol, is referred to as the good estrogen. And the reason is because the estriol has a little bit of anti-inflammatory benefit. It can be assisting in the process of weight loss. It actually has some cancer kind of preventive qualities to that estrogen. If people have autoimmune, it can help kind of tone down an autoimmune process. And so typically, as we do our lab testing, if a woman is low in estrogen, then we're kind of leaning towards you know, uh, providing a natural bioidentical form of that estriol, the good estrogen too. But the other thing I want to talk about for women is after DHEA, it goes towards testosterone. So testosterone, I would say, is not talked about enough with women, in that the benefits are much the same in terms of what testosterone can do for both men and women. It ties into mood, energy, behavior. We think about low libido or low sex drive. Testosterone is one of the first things we're thinking about what's going on with that. We think about even for women, if they're struggling with losing weight, especially if they get around the time of menopause or after menopause and they find they gain weight more easily, struggling to lose weight, lower testosterone can easily be part of that barrier as to why they're having difficulty losing weight as well. And so, going back to Jody's question, how do you do blood work to check testosterone levels? So this is how we do the blood work: is we do a more thorough testing of hormones. And Jody here is asking more specifically for men. So what we're focused on more for men is that pathway from cholesterol to pregnenolone to DHA down to testosterone. We care about cortisol, of course, too. Will give us direct measures. And then part of her question is, what kind of treatment or supplements are available? So the first thing we think about if testosterone is low in either men or women is we go one step up to DHEA. If that precursor of DHEA is low, then we need to get that up to a healthier level. So in blood testing, we look for DHEA to be kind of in a 200 range for women, a little bit higher for men as well. And if that's not the case, well, that's one of the first things we're going to do is we're gonna recommend DHEA to give more of that precursor, so it can naturally filter down into that testosterone, in the better production of testosterone. Aside from that, there are some herbal things that are known to be very effective. One of them is called Tomcat Ali, kind of a strange name, but it's an herbal product that's known to be very good for conversion. And really, that's not the only one. I'm not going to list all the herbs. There are several ones that are out there that have good research behind them that allow for better internal production or better conversion into that final product of testosterone that we're looking for men and women as well. Testosterone in terms of our clinic, testosterone has more limitations on it because in our clinic, as a functional medicine clinic, we can recommend and offer a natural bioidentical progesterone or estrogen. Testosterone, though, is more heavily regulated by the FDA, and because of that, it can only be acquired through prescription from a medical provider. So, and that's due to the fact that testosterone was abused for such a long time. It probably still is to some degree by people that are like bodybuilders and that using it in ways that it really wasn't designed for. So because of that, the FDA has really clamped down on that, and it's much harder to get. I will say that there are some people, some women, and could be men too, that we work with where we can be doing the DHEA, we can be doing different herbal things, and maybe testosterone improves some, but it's just taking too long. It's improving too slowly. And I should mention too, other nutrients, things like zinc, vitamin D, magnesium, other basic nutrients tie into testosterone production. Those are all important as well. But if we find in a more natural functional medicine process that it's being too slow to improve, then that's when we're saying, hey, you know what, maybe you connect with a medical provider. We have people, other providers in the area we can recommend. Connect with them and maybe try doing like a prescribed version. When getting them into prescribed, I'm more a fan of versus doing a prescribed testosterone injection once or twice a week. I'm more a fan of doing what's called microdosing, where you're doing a smaller dose every day. It's more mimicking your body's production instead of doing like a chunk, once or twice a week, and your body will use it and it kind of wears down. It's easier to keep a more steady, even level compared to what your body might be producing there too. Next question is, what supplements do you recommend daily, weekly, age 60s, besides vitamin D? Okay, so in general, the way I'll phrase it, because it's tricky when I'm doing a thing like this, I can't recommend to a specific person, but I can talk in more of a general sense. What am I thinking about, or if it were me in that situation? I would say if you're not doing any lab testing, doing a good quality multivitamin, multi-mineral. Um, the reason for that is even if you're eating a very healthy diet, it's likely you're still not getting enough of certain nutrients because in our society, it's typical for the same farmland, the same soil to get farmed over and over and over again. So the nutrient density of, let's say, broccoli now is less than broccoli 20, 30 years ago, right? And so just because of that factor alone, even if you eat healthier than anyone else there's a good chance you're probably deficient in certain nutrients. Aside from a good quality multivitamin, this is again is without doing any testing, just in a general sense. Um, So I would think about, of course, vitamin D, like you had asked about. And then I would think about probably most people are deficient in the healthy fat, the omega-3. So whether you do that with a fish oil supplement, I tend to not recommend a fish oil supplement. I want to encourage people to get that through their diet. So what you're thinking about for the healthy omega-3, the healthy fats, are things like avocado. Cooking with avocado oil, I think, is a better choice for an oil to cook with. Different nuts and seeds, you can get some healthier fats from that. And the benefit of the nut and the seed is you're also getting certain minerals and some fiber. In fact, if you look into material, there is this research that's been done, referred to as the blue zones. And in that blue zone information, what they do is they travel around to different parts of the world where the percentage of people that live to be 100 or older is kind of higher than the average of the rest of the world. So they go through and they go to these areas of the world where they call them centenarians. They live to be 100 or greater at a greater rate than other parts of the world. And they're basically learning about them. What are they doing differently? What is their diet like? What are the variables that seem to be contributing to living to an older age and being healthier at an older age? And one of those variables is regardless of the part of the world, these are people that are eating nuts and seeds on a regular basis. So a great source of minerals, great source of fiber, plus getting some of the healthy fats along with that. Also, for the omega-3, I'm a very big fan of doing a good quality extra virgin olive oil. Not so much to cook with it, because what happens, although I will still cook with it, sometimes I might roast vegetables, to really get the benefit of the healthy fat omega-3. Instead of cooking with it after your food is cooked, your food is on your plate, to grab a good quality olive oil, just kind of drizzle it over whatever part of food that you want to, for that 5 or 10 seconds of that effort, it's a super easy way to bump up your healthy fat intake. And some people already know, you can get these better quality all extra virgin olive oils where they're already infused with different flavors. So, for example, I've used ones that are infused with garlic or kind of butter, Italian, chipotle, whatever. There's all different kinds of flavoring ones. And so when you have a few different flavored extra virgin olive oils, you can decide with the food that you're eating, you can kind of match or pair what you're putting on to have that flavor match or go well with your food. It can actually enhance the flavor of your food, and a super super easy way to get more of those healthy fats into your body at the same time. So again, for that question, what supplements do I recommend daily, weekly, age for people that are in their 60s or maybe older? Covering the basics, vitamin D, omega-3, either through a good quality fish oil or ideally more from diets. Good quality multivitamin. That'd be like the minimum that I'm thinking about. Beyond that, getting back to the issue of helping to maintain, if not increase muscle tissue, then you're looking at things like a good quality protein powder, maybe collagen. There could be a lot of benefits of doing that, especially if you are exercising. Want to make sure that you get enough protein to support that muscle tissue or increase that muscle tissue. Very, very smart idea to do that as well. Okay. Next question is, do you use synthetic or is your progesterone estrogen bioidentical? We only do the bioidentical. And so we have on our shelves here, once we do testing and we see that there's an obvious need for, let's say, progesterone, estrogen, we only do, for example, progesterone. It's referred to as a natural or a bioidentical progesterone. It's a lotion or a cream that you put onto your skin. On your skin is actually a very good delivery method to get it absorbed into your body, into your bloodstream. Even better, probably, well, it is more reliable than doing a pill or a capsule for an estrogen and progesterone, because when you take it by pill or capsule, it goes into your stomach, and usually your stomach acid is going to break some of that down, and we don't really know how much. So it can be hard to know really how much is the person getting versus how much is getting destroyed within in the stomach area. So when you do a natural topical bioidentical progesterone lotion or cream, it's very easy to apply. And I feel like you get a little bit more reliable dose into the body as well with that. So, um, next question is asking about remedies for hair loss. So hair loss is interesting. We'll have women that'll come in where that might be one of their main concerns is they're noticing for different reasons over time that the hair is thinning, they're losing hair more easily. I've had women come in where they will describe like when they wash their hair or brush their hair, it almost feels like it's coming out in clumps. And especially for women, this can be quite a big deal because more so than men, for women, your hair is can be a big part of your identity. Just kind of what you look like and how you want to look as well. So it's quite a big deal and can be a very big stress itself. So in women specifically, and the person asking the question, they didn't provide a name. So I don't know if they're male or female. So I'm going to talk about this more in relation to women. So there is a pattern we see with women and hair loss in that it's almost always either related to thyroid and thyroid function slowing down. So we can spend a little bit of time talking about thyroid here. I think that'll be good to talk about that. Um, or it can be in terms of female hormone balance, it can be progesterone levels are dropping down. So let's say we do our more thorough testing beyond looking at female hormones. Typically, when we look at the female hormone testing, we're going to look at a more thorough testing of thyroid, look at testing of insulin for blood sugar control, look at a lot of other, um, looking at liver and kidney and electrolytes and thyroid and cholesterol, just a whole kind of large panel of testing as well. Let me stop sharing my screen here for a moment, just to go back. Okay. So when we look at female hair loss, if we do that more in-depth testing of thyroid, let's say everything comes back normal or looking good from a functional medicine perspective, we can kind of set that aside. And the next thing we go to, so thyroid is number one on the list. The next thing we look at is what's going on with progesterone. If progesterone is testing lower than optimal, then that's the next likely thing that's resulting in easier hair loss for women. If we test both thyroid and progesterone and things are looking quite good, then we start getting into individual things like could even just be a lack of enough protein. We think about zinc. We can get into like biotin, individual nutrients. Last on that list of possibility, there is a type of autoimmune that actually attacks the hair follicles, and alopecia is the name of it. And typically, the way you identify that is you go to a dermatologist. They get a sample of skin, they send it to a lab, and they do special testing to see if that's the case. But among the list of possibilities, it starts with thyroid as being the most likely, progesterone the next one, then we get into certain deficiencies, and that autoimmune to be kind of at the bottom of the list. It's very common that for women with hair loss or hair thinning, it's both thyroid and progesterone. So then we just go after both. I've had women that had severe hair loss to the point where they're wigs, and once we get the hormones figured out and get their body healthier, get the hormones balanced, it's kind of this progression where initially they'll see the hair loss is slowing and stopping, and then they start to get new hair growth. So it takes a little bit for that transition, but eventually the new hair growth starts to come back, and eventually where they're happy with the result of that too. So um, there is room now for the next question if somebody has a next question. I would like to, in about our last 20 minutes, I would like to make sure we talk more about thyroid because it's such a big issue for a lot of people. So I'll start talking about thyroid when it comes to testing and kind of the things that we're thinking about. And if you have other questions about that or anything else, just go ahead and put the question in. I'll get to that the best I can. So thyroid is easily one of the more common reasons why people, and again, there's more women that come to us in our clinic. It's a more common reason why people will come to us either because they already know that they have a thyroid issue and they've been prescribed a thyroid medication like levothyroxine is the most common one, and they can still tell they don't feel good. They can tell with thyroid that they are just more tired, they're gaining weight, having difficulty losing weight, more achiness in muscles and joints. Again, the hair loss that we talked about, dry skin, this whole long list of symptoms that happen when thyroid becomes a problem. And so it's either that or very often they've already had thyroid tested medically before coming to see us in more of a natural environment or more of a like a functional medicine environment. They'll come in and say, well, I've already had my thyroid tested. I was told it was fine. And then when we get those lab results, we see what was tested. A lot of times it was very minimal kind of surface level testing. A lot of times it was only TSH, which is what's most commonly tested medically. If they're lucky, it's TSH and the free T4. If they're really lucky, and this is kind of how I define if they're going to a pretty good medical provider or not, is if they're actually including the free T3 within that testing as well. So um, we have a lot of women that'll come in that they're being told they don't have a thyroid problem, but when we do our more in-depth, more thorough testing, that's what functional medicine is. It's all about doing more detailed testing to have confidence that an area is working okay or there's a problem there. It's really about taking out the guesswork so we really know what's going on. When we do our more in-depth testing of thyroid, we find that there actually is a change of thyroid function that is contributing to some of their symptoms or their concerns. So the thyroid in general, it has this nickname of the great mimicker because it can, when the thyroid gets off track, and typically it's going to go low in function for most people, there is such a thing as overactive. That's less common, but it does happen. I'll talk more about the low thyroid function. It mimics so many other conditions that um, some people, they're going around to different doctors trying to figure out why they don't feel well, only to have it come back to primarily be a thyroid problem. So what do I mean when I say a better testing of thyroid? So certainly we still want to know what's going on with TSH. We want to be looking at the free T4 and the free T3 to understand the difference between the T4 and T3. Your thyroid produces primarily a version of thyroid hormone that we refer to as T4. The problem is that T4 really doesn't have a whole lot of activity when it comes to connecting to your cells. It really doesn't do a whole lot when it comes to determining your metabolism, your energy production. It's not until T4 gets converted into T3. So again, the thyroid produces primarily T4, then that goes elsewhere in the body to convert into T3 or the free T3. A lot of that conversion, about 80% of that conversion happens within the liver. So the majority of converting T4, T3 takes place in the liver. So with that understanding, you understand why it's important to have good, healthy liver function because if the liver is stressed or things are going on with the liver, that right there will impede the ability to convert T4 into T3. We care about T3 because the free T3, we call this the bioactive form of thyroid hormone. So the free T3 is the main player. The free T3 is what does most of the connecting with your cells and tissues, then determining your energy production and your metabolism and just the energy that you have during the day. So we see lots and lots of people that will come in and they're being told that their thyroid levels are okay and they're only getting TSH tested, only getting the T4 tested. And in fact, they may actually look okay even from a functional medicine perspective. But then we go the one step beyond and look at the free T3 and we find that's where the problem is. And that's a big deal because it's the free T3 that does most of the determining your metabolism and energy production. So beyond TSH, free T4 and free T3, we care a lot about testing what's called reverse T3. So reverse T3, it's kind of a check and balance in the thyroid hormone system, but what happens is if reverse T3 is starting to elevate too much, it has a blocking effect. It will block the ability of the free T3 to actually connect to the cell. The reverse T3 will kind of like block that ability. The best reasons that we know of as to why the reverse T3 will increase is due to more stress, which then leads to more cortisol production. That higher cortisol production will push that reverse T3 to go higher. The other reason is low selenium. So a trace mineral called selenium can result in that reverse T3 kind of building up more. And I should mention too, when you look at the converting of T4 into T3, again, a lot of that happens within the liver. But the critical nutrient needed to convert T4 into T3 is also that trace mineral called selenium. So selenium is kind of a big deal when it comes to thyroid or getting enough of the right kind of thyroid hormone into your body. So again, if we go down the line, the minimum thyroid testing I'd want to see on someone is TSH, to also look at the free T4, the free T3, the reverse T3, and the last two for minimum would be looking at the thyroid antibodies, which would be thyroid peroxidase antibody, often labeled as TPO antibody, so thyroid peroxidase antibody. And the other one is thyroglobulin antibody. So the two main antibodies. So what this means, and we always test this on people, and we've had people that will come to see us. They've been on thyroid medication for a couple decades, if not more, and they've never had their antibodies tested, never had the TPO or the thyroglobulin antibody tested. So they never knew why their thyroid became a problem. And it's because their immune system changed and the immune system started going after the thyroid, either the thyroid gland or some aspect of thyroid function. It's because they had an autoimmune. That's why their thyroid function slowed down. And then that's why they ended up getting prescribed a thyroid medication as well. There are other antibodies to look at, but some of those more relate to when it becomes overactive. I won't talk about that in this particular session. We can talk if somebody has questions about overactive thyroid, we can cover that on a future session as well. So again, so those six would be the minimum as a functional medicine doctor that I would want to see to really have a good handle of how a person's thyroid is functioning. TSH, free T4, free T3, reverse T3, and the two antibodies, the TPO antibody and the thyroglobulin antibody. So when we see that thyroid, and so let me step back and say another way to think about this is that a lot of people medically will get their thyroid tested. They're told based on like surface level testing that their thyroid's okay. And when in reality, when we do our more in-depth testing, they're operating at a level that I refer to as being pre-hypothyroid. So the best way to think about it, just like if somebody were to be diagnosed as being pre-diabetic, whether it's medical or natural, we're not going to wait around for that to get worse before we do something. And really, the whole thinking medically, really every healthcare provider, the thinking needs to change that there is this category of pre-hypothyroid before it goes to clinically hypo, like a full clinical hypothyroid as well. So a lot of people easily, there are millions of people that are in this pre-hypothyroid range that are being told their thyroid is normal when it's not. It's starting to slow in function. It's kind of struggling in function, and it's in a range where it is resulting in many of the same symptoms that we think of as hypothyroid. So again, it's fatigue, weight gain, more achiness in muscles and joints, hair loss, dry skin. It's a pretty long list of what thyroid can do to you as well. So as we look at people in functional medicine, we look to see are they in this pre-hypothyroid range? And again, just like if we're pre-diabetes, we're not going to wait around. We're going to take action. And there's some pretty impressive things that you can do with nutrition or different nutrients that can be very powerful to feed that thyroid gland, to feed that whole thyroid hormone, the creation of that process of creating thyroid hormone, and then to actually to increase the production of both T4 and T3 and have quite a dramatic impact on energy and metabolism and all the good stuff that people are looking for. So if you were to get any one piece of information out of this particular session, if you're somebody that gets thyroid tested, I'd recommend that you really push for them to always check the free T3, especially if you're on a thyroid medication. Make sure they're also testing that free T3. Even if you have to be a little bit aggressive about it, because nobody's going to advocate for you better than you. So even if you have to be a little bit pushy about it, it's worth the effort to try to get whoever is, medically you're working with somebody to get them to add that free T3 onto your testing. So then the next thought is, then if they're testing the free T3, where do we want that free T3 to be? In functional medicine, we want to see the free T3 to be at least at 3.0. So it's easy to remember because T3, 3.0 minimum. If the free T3 is testing lower than 3.0, if it's in that 2 range, then you can be fairly confident that your thyroid hormone level is at a little bit lower level, meaning that you don't have your best metabolism, you don't have your best energy production. So again, across the board, anyone that we're testing the free T3, we want to see it at least at 3.0. If somebody has a goal of weight loss, specifically, we want to see the free T3 really in that upper 3 range, maybe even a little bit in that 4 range, to know that we're really maximizing the amount of thyroid hormone so they have their best energy production, their best metabolism at the same time. And you just will never know unless you're doing the testing. Any other questions as it relates to thyroid? Those are the important basics. So from that, we have about 8, 9 minutes left. So let's go into, so we talked about in terms of the email questions, there was a few things. We talked about vitamin D. Thyroid is one of the things that I was asked to talk about. Let's touch on the last a little bit. Let's touch on cholesterol. Such a common thing, right? So cholesterol is really, I feel like it's made out to be the bad guy. And I want to like impart with everyone that cholesterol is not the enemy. Cholesterol is necessary for having a healthy body. And we already saw that as we looked at this hormone chart. Cholesterol is the precursor, it's the beginning ingredient of what's needed to create all these other hormones. In the original cholesterol research that was done many decades ago, they found what we all hear about is that if cholesterol levels go too high, there can be some cardiovascular consequences, and that's very real. We are concerned when cholesterol goes too high. From a medical perspective, they will say if your cholesterol is over 200, there is a chance they're starting to talk about cholesterol. Maybe they're starting to talk about a cholesterol medication. Certainly, if it's getting in the upper 200s or 300s, then there's no question. They're just recommending that you go on a cholesterol medication. From a functional medicine perspective, if you're in this 200 to 250 range, we don't get too worked up about that. We just look at that and say, well, we need to get this person healthier, need to clean up their diet, get more activity. We just in many different ways, we need to get their body healthier to then have that come down more naturally. There is a very interesting connection between thyroid and cholesterol. When you exclude every other variable or possibility, and we look at what's going on with thyroid hormone and cholesterol, that one variable, if thyroid hormone starts to drop down, that one element will result in cholesterol increasing. So what that means is that there are many people who have kind of increasing cholesterol over time instead of being put on a cholesterol medication. And I'm not going to dismiss the fact that there are some people that maybe need to go on a cholesterol medication because it's such an out of control problem for them. But many people that are initially put on cholesterol medication, if they were to simply get their thyroid tested in greater depth or greater detail, and if they were in this pre-hypothyroid or actually fully in a clinical hypothyroid, get their thyroid working better, that one variable of getting the thyroid working better is going to result in cholesterol naturally coming down more easily as well. Okay, so it's very, very important to know that connection between thyroid and cholesterol. So back to cholesterol. So in the original research, of course, they found that too high of cholesterol, there can be cardiovascular consequences. What they also found in that same research that was done many decades ago that we typically don't hear about is that there's a consequence if cholesterol goes too low. And the consequence of that is that low cholesterol can increase the chances of developing cancer. So to understand that, you have to understand what cholesterol does in the body. So again, cholesterol is not the enemy. In our body, we need a certain amount of cholesterol to be healthy. So we already looked at how cholesterol is a precursor to different hormones. Cholesterol gets incorporated into that cell membrane, that outer layer of all your cells and tissues. Cholesterol also acts as a pretty decent antioxidant. So what that means is cholesterol has this ability to protect cells from damage, or if cells actually get damaged, cholesterol will come to the rescue to help repair that cell damage. So if cholesterol it ends up being too low, then you don't have that same protective ability on your cells and tissues. So if cells are getting damaged, maybe certain cells can get damaged to the point where it ends up damaging the DNA inside the cell. DNA damage can cause that cell to change to become an abnormal cell or a cancer cell. So, having enough cholesterol, having a healthy amount of cholesterol, can be can help protect against cancer or the formation of cancer cells. So, what do we think of as like a good level? So, from a functional medicine perspective, we think of as ideal kind of 170s, 180s. Again, if you get over that 200, you're in that 200 to 250 range, don't get too worked up about that. We need to kind of just get the body healthier, get, if there's issues of blood sugar control, get blood sugar control better, get the liver working better, um, get more antioxidants in the body. So sometimes cholesterol increasing. So let's look at it from that perspective. So we say then, why does cholesterol increase? So to understand why, we think about what does cholesterol do? The majority of cholesterol in your body is actually manufactured within by your liver. So if we just take a ballpark percentage, about 75% of cholesterol is produced inside your own body by your liver. About 25% comes from diet. And those percentages will vary from person to person, but just for explanation, we'll say 75% produced within by your liver, 25% from diet. And so if a much larger percentage is produced in your body by your liver, why is it producing it? What's the purpose, right? So again, it goes into understanding what cholesterol does. So again, cholesterol is needed for the creation of different hormones. So if hormone levels are getting too low, it could be that your liver is purposely producing more cholesterol to try to improve hormone levels within the body. It could be that due to diet or stress or other variables, if the overall antioxidant status of the body is decreasing, because again, cholesterol is a pretty decent antioxidant, it could be that the body is telling the liver to produce more cholesterol to increase the antioxidant status of the body. We need enough antioxidants to protect our cells from getting damaged, or in the case of cholesterol, to repair that cell damage as well. Okay. Any other questions? It's a pretty good background on cholesterol. I guess maybe to expand on that, then let's talk about cholesterol medications, what they do. So typically a cholesterol medication is referred to as a statin medication. There are many different kinds of statin medications now that can be prescribed. The way that they work for most of those medications is when a person takes that medication, it actually suppresses the liver's ability to produce cholesterol. So cholesterol levels will go down in blood testing because the medication is suppressing the liver's ability to produce it, right? And so um, the problem is when that medication is suppressing the liver's production of cholesterol, that's not the only thing it's suppressing other things. One of the more notable things when it comes to nutrition is we know that taking a statin or a cholesterol medication will suppress the liver's production of a really important antioxidant called coenzyme Q10 or CoQ10. This is why when people are on a cholesterol medication, it's a very smart idea to be taking some CoQ10 because that medication is suppressing the liver's production of that CoQ10. We care about that CoQ10 antioxidant because CoQ10 is very protective of aerobic tissue. One of the most aerobic tissues in your body. So what that means are tissues that utilize a lot of oxygen. One of the most aerobic tissues in the body is your heart hopefully is always working, it's always pumping, it's probably consuming or utilizing more oxygen than any other tissue in the body because it's always working, right? It has to always be working. And so the irony is that if a person has high cholesterol, they're put on a cholesterol medication to lower cholesterol to reduce the chance of kind of build up in the arteries or resulting in some kind of a blockage leading to heart attack or stroke. So technically, less cholesterol can reduce that risk somewhat, but at the same time, they're decreasing this antioxidant called CoQ10, and so now they don't have that protective as much of that protective antioxidant. So it's almost like you're trading one problem for another, right? So certainly you can lower cholesterol, maybe reduce that kind of risk, but you're trading off for a different risk because now the heart, the blood vessels, those cardiovascular tissues, don't have as good a protection because of lower CoQ10 as well. So whether it's on your own or through another provider, it's a smart idea to consider taking some CoQ10 when you're on a cholesterol medication. So I'm going to wrap up. We're almost exactly at the hour. Just want to mention whether you're watching this live or maybe you're watching this as a recording or just part of the video as a recording. If if you're looking for more help in getting very specific in terms of organ function, toxins, hormones, food sensitivities, digestive issues, different nutrients in that too, that is what functional medicine is. It's all about doing a better, more detailed testing. And we're doing this every day, with tons and tons of patients. We've done this as a clinic. It's myself, there's two other doctors, there's three doctors here in total that work here. We all do the same kind of work, so it doesn't have to be me that you see. We have a couple other doctors here, and they're on our website for healingchoices.com. You can read a little bit about each person as well. We do offer for anyone who is brand new to our clinic, we offer a free initial consultation. We'll talk with you whether it's in person or if you're a little bit farther away, it's not easy to be here, especially if you're in another state. We can work with people that are even in other parts of the world as well. It can easily just be a video, just like we're doing a Zoom here right now for this Q&A session. It can be a one-on-one video Zoom kind of appointment. And there really is no difference whether we meet in person or we're talking remotely through video or phone. It's all going to be the same conversation. If then you decide that you do want to work with us to help you, everything we do from the testing to going over results to the follow-up appointments, it's going to be exactly the same regardless if it's video or in person. So technically, I've had patients that I've seen, I've actually never met them face to face. It's all, I've gotten to know them quite well though, just through video and that too. So again, that initial consultation, at least we are, so we've done this for a while. We'll continue to do it. I can't say forever, but for now, we're still doing that initial consultation. It's a 30-minute appointment, at least 30 minutes at no charge. And the point of that is it's just an opportunity for us to learn about you, your symptoms, your concerns, what you're looking for help. We'll describe more about how we do testing, how that testing process works, and just how the whole functional medicine process works. We're known for being very low pressure. We just want to learn about you, help you make an informed decision. But then if you do decide that you want to work with us, then we get the ball rolling, determine what's going to be the best testing that's going to be the most beneficial, get that testing going, results come in, go over the results, and start the plan of action at that point too. So if that interests you, it's available to anyone. And it's as simple as just either calling the clinic or even emailing. So the phone number, you can find it on our website too for healingchoices.com, but the phone number is 763-241-5436, or the email would be service@healingchoices.com. And as a final mention, whether you're watching or listening to this as we're doing this live, or especially those if you are watching this as a recording, whether it's the entire hour or you're watching pieces of this. My plan right now is to do this on a once a month basis, and you're always welcome to come back and ask whatever questions. Although I understand that, we pick a day and time, not everybody can attend. So if you have a question or something, then definitely just email it to us to service@healingchoices.com. And I'll get through as many of those email questions as I can, in addition to kind of the people that are attending as well. So, all right. So thank you for attending. Thank you for the questions. I hope that was good information for you. And I'm gonna end the session now. And if you have other questions, send us an email. And then we will, sometime in February, the next time we do this, we'll send out information by email when the next one will happen. And if you have other questions, send us those questions by email. Otherwise, have a great night, and I will see you next time. Thank you.